saying their names is essential because it keeps your history alive. I come from storytellers. So Annette Bird is my girl. That's my grandmother. And when I think about her 93 years this September, there's not much of her story that I don't know. And the reason is every time we come together, we leave late. If I go to visit, you don't come for less than an hour. That's illegal. She's going to tell those stories, and she's going to tell me about Ivy Johnson, her father. She's going to tell me about Grandpa Tom, my great-great-grandfather. She's going to tell me about Grandma Mary and the generations that live today through us. And those are the gifts that you can't number, you can't count.
You're listening to a very special episode of Health Disparities Podcast from Movement is Life, recorded right here in Detroit, Michigan. I am Ber Henda Williams, a media producer, podcast host, womanist cultural strategist, and I am a native to the Metro Detroit area. I have been raised by Detroit. I am of Detroit lineage. I am a assembly line baby and proud of it. And I carry a deep love and responsibility to the city of Detroit and the community and the commitment that shapes it. And I'm so honored to be a guest host here today, but we're opening up a new series called Let's Talk About Health, because health is not just clinical, it's ethical. And I'm joined here by Dexter Sullivan, who is the CEO of Black Legacy Advancement Coalition. And Dexter is a global strategist and community builder whose work spans more than 20 years. Okay. He has touched all of the continents, countless cities across the USA, and his work specifically focuses on strengthening leadership pipelines, expanding economic opportunity, and building systems that are better suited and will support the infrastructure of Black communities. Dexter, welcome.
My sister, it is a joy to be with you. Thank you for inviting me into this radiant space. It's a flex to be here, and I'm just glad to be able to talk to you today.
Well, we're going to get into it, Rich Unc. I'm sitting here next to Rich Uncle, and we're just going to get into all of the things. You know, I think a lot about legacy just in general.
Yes.
But if you could name for you on your journey, what have been some defining moments?
Oh my goodness. I would say, first of all, being born in Detroit is defining. I think about my grandparents and their migration here in the 40s. I think about my great-grandfather who started in farming and agriculture. He bought 100 and some odd acres in the late 20s, early 30s. And raised his family on that land. He sold 10% of it to a white gentleman and opened a restaurant on the land, made his investment back in a year with that move. So when I think about things that have been defining that I've done, I know that it's built on their shoulders. But I think about my rearing through Detroit public schools with educators like Ralph Bland and Ray Johnson, Hubert Massey, Spencer Murray, Bessie Burden. And these individuals, when my parents got done at home and dropped me off at school, they ensured that legacy was forming with Black literature, making sure that we were engaged with narratives like Phyllis Wheatley and Mary McLeod Bethune and so many shapers of Black culture. And I thank God that I was infected with that early enough that my entire ethos would really be centered around Blackness and its excellence, and that we were second to nobody and equal to all. So Detroit is more than a city to me. It's a foundation for freedom and a platform on which the freedom that I get to build is derived from. I think about the words of Thurgood that he would ask his nephew, what have you done with your freedom today? And I think about that often. What am I doing with the Detroit gift of freedom that was given to me.
Yeah, Detroit has some waters.
Oh my
right,
God.
of cultivation.
Yes.
It has a way of shaping. And shout out to Dr. Spencer Murray.
My guy.
Yeah. Legendary educator, convener, healer, noted. So shout out to Dr. Spencer Murray and his amazing organization, Do No Harm.
Yes.
Doing some amazing things with me.
In the A.
Yeah, that's right.
Yeah.
That's right. But Detroit, foundation.
Mm-hmm.
And so let's get into a bit of your lived experience and growing up in Detroit and how it shaped your organization, Black. How did being a student in the school system, as you said, you're standing on the shoulders of your grandparents and, of course, I'm sure amazing elders. How has that shaped you?
Similar to you, my family was very much involved in the automotive industry. And so my grandfather, who is my twin, Roosevelt Bird, he raised two daughters, my mom and my aunt. He's the eldest of 23. My grandmother, the eldest living of 13. So we're a very, very big family. If you know any Johnsons, Lloyds, Cooks, who else? Browns, Smiths, we everywhere. But I think about their beginnings and just how central family was. And I can remember as a little kid when I'd stay with my grandparents, my grandmother making my granddad's lunch at 3 or 4 in the morning and him being out the door no later than 5 and, starting the day early. Those were behaviors that we began to emulate and gave us that edge that the early bird gets the worm.
Come on.
And it ain't never too early to start working. I think about my dad and his entrepreneurial journey. He was doing energy before that was really popular as a Black man in the early 90s, starting our energy company here in the city of Detroit and brokering deals for natural gas supply for Detroit public schools and getting me exposed to that level of entrepreneurialism that I didn't know was possible. My mother, we're talking about health. She was a nurse and still is in healthcare today. She was the one that really exposed me to the reality of a disparity and what it meant. She was the stroke educator for Detroit Medical Center for many years, teaching us about heart health and getting our bodies right. And being a part of Detroit in the 90s, I don't know a better childhood than that.
I don't either.
Because
I don't either.
It was dope.
It was, what a time to be alive.
What?
Driving up and down 7 Mile Road, wasting your parents' gas.
And we stayed right at 7 in between Livernois and Woodward.
Stop it.
Where
that was the spot. That was like the nexus of it all.
Literally.
Right there at Livernois and Woodward. That was the nexus of it all.
Or Grand River, one of the two.
That's it.
I don't know if we knew what we had. And it's still good today.
Sure.
But yeah.
Bell out on a Friday night in the summer.
Yo, we outside.
We were outside.
Yes.
We were so outside. But I don't want to get myself in trouble, so I digress. But as you were naming, healers in the lineage. We may not look at nurses as healers, but they are.
Oh my gosh.
Right.
I think about my mom's stories coming home and things that she would tell us of her experiences. She was a trauma nurse, worked on burn unit, worked on cardio units, led those units, and just some of the things. I can remember one story of a gentleman who came in unconscious, and once he was recovered, he would talk about how people mishandled him, but he remembered my mother and the way that she cared for him. And he was in a coma while she nursed him, but he remembered her voice and met her later in life and said, "I remember you. Thank you for taking care of me." Those are the kinds of realities that the men and women of Detroit come from a different cloth, cut differently, and just consummate professionals in so many fields: science, engineering, healthcare, education, the arts, you name it, we've been there. We're sitting in Black legacy right now. Sharon Madison, Michael Steinbeck, who I love dearly, what they mean for Detroit in the leadership that they bring, owning a high-rise building in Detroit. That's major. And so Detroit has been doing it and putting on for a long time. I am in the now work of preservation. How do we keep the legacy moving? And how do we not lose the narrative? How do we not lose this story? Growing up in a majority Black city, I think it's easy sometimes to take it for granted and you don't keep track of what you got.
Until you travel someplace else. Until you're in metro, flying out somewhere. Does it really sort of hit you in a visceral way when you're talking to maybe other Black folks or other folks, and you're in the way the city is perceived and then the reality that
Yes.
Because everything that you've named thus far, when we think about trauma and you said cardiovascular, we're dealing with a heart. And your work, because of the legacy that you come from, it feels very heart-shaped. And so we want to talk more about the heart-shaped work that you do in labor and the preservation of legacy. Can you name for us, how urgent is this moment that we are in now to preserve?
Yes.
Legacy, yes, but also health and well-being. Can you help us synthesize it? Because I know it's difficult, but I know that you can do this. Let us know the urgency of this hour that we're in.
It's incredibly urgent. Two of the conversations prior to me coming here today, this morning in Grand Rapids, I was meeting with one of the executive leaders of the largest health network there, Corewell, and we were talking about how to bring some of this work forward in relevant ways. And I think about now the urgency of a climate where we're having rollbacks of systems, rollbacks of policies that have prevented negative fallouts, especially as it affects Black and brown individuals, whether that's in housing, whether that's comorbidities. All of the social determinants of health are being challenged in significant ways. Some of those things slated to fall at the most inopportune times. So there are some policies after midterms that we'll start to see go into effect that will really affect those that are benefiting from Medicaid, Medicare, systems that we never really thought we would be without. But I think now it is pushing us into more restorative practice where we take responsibility for our bodies. We take responsibility for what we're putting in our mouths, not only because it's the right thing to do, but because it's what we have to do, because the medications may not be there. Access to insulins may not be there. What are we doing to self-heal and to self-medicate? There's a verse in scripture, physician, heal thyself.
Come on.
And sometimes we're so busy taking care of everybody else in the household that we put ourselves on the back burner. It's proven that medical doctors and nurses are some of the least healthy folks because they have access to plenty. But sometimes when those resources are brought down, it causes you to look deeper. And so I think from a very granular level, we're doing that. I know in our work, we're actively looking at growing our capacity, and we're noticing that funders and institutional philanthropy is saying, okay, what are some inventive ways? Because we never followed the textbook when it came to philanthropy.
Oh, you can never follow the textbook. And argument, no. Nothing. There's everything is creative and couture. Let's talk about couture solutions, because nothing about Black folks is textbook. There's nothing that the Academy can find a solution for.
Yes.
So tell us, what are some of the couture solutions that you have seen and found that you're using in your work to help advance us, not only as a city, but as a people?
I love that question because it's layers. And many times we think that we have a language problem, or we think that people don't understand when the systems that surround us daily especially those that are white laced, those systems don't necessarily have the vernacular that translates to the heart. Black people by nature are loving and caring and not linear. So we don't line up in rows to show up to have a good time. We show up to the 2:00 function at about 3:30 with what we want to. And a lot of that we don't realize is cultural. We have a culture of celebration and honor and joy, jubilation. And African culture is lived in circles. A lot of things in the round. And so I often look at, are the solutions that we bring significant and relevant to the solutions that we want to be answers to problems we're trying to solve? And if it's significant enough, it will overwhelm the challenges. We lead with love and we end with love. And that to me is the difference maker in heart work, where, yes, we're focused on the social determinants of health. We're focused on housing, education, resources, the practical things. But I want to know how you're doing.
That's right. Before
I put you in a program or in a slot or number you, I need to know you. How are you? Because if I can get to know you and your story, I'm going to find a connection point. Because at the end of the day, we all cousins. We got some things in common. And if we can be clear about that and clear about who we're serving one to another, our creator can get involved in that. And it's a beautiful experience. I think sometimes we're mimicking systems that were given to us that we didn't engineer, and they're not coming from the heart. And so it's hard to sustain that. If you superimpose colonialism on culturalism, you're going to have fractures. And so we're constantly looking at what are the natural ways that we communicate, and what are the iterations of love that show up in 2026. Maybe they have some more technology flair, but we birth technology. Okay, we can go back to Addis. We can go back to West Africa, and we can go to the Congo right now and see the first vibranium. Okay, we can understand what that is on the continent, and so many things that we've given the world have been hijacked, and the storylines hijacked where we don't remember who we are. So that self-love, as we're loving others, that self-love to reflect on what is the true essence that we bring the world by way of culture, by way of brilliance, by way of resources. We don't have any limitation. All of the answers are already built in.
You know, I want to bring it back. I mean, you said several things, because I'm over here thinking about ring shouts and hush harbors. I mean, but that could be that's a whole other segment.
This girl, brilliant. Okay.
I mean, my brother is brilliant. But you named something I think that is super important, the remembrance. Unfortunately, because of the space and time that we are in the age of information and disinformation.
Yes.
And I love what you said about fragmentation. How in your legacy, when we think about all of the amazing projects that you have going on right now, how are you weaving that remembrance into your current work? If you could maybe name some projects that you have upcoming.
Oh my goodness.
Right? Where we're weaving in the remembrance.
So saying their names is essential because it keeps your history alive. I come from storytellers. So Annette Bird is my girl. That's my grandmother. And when I think about her 93 years this September, there's not much of her story that I don't know. And the reason is every time we come together, we leave late. If I go to visit, you don't come for less than an hour. That's illegal. She's going to tell those stories, and she's going to tell me about Ivy Johnson, her father. She's going to tell me about Grandpa Tom, my great-great-grandfather. She's going to tell me about Grandma Mary and the generations that live today through us. And those are the gifts that you can't number, you can't count. In our work now with housing, it was important to me that our spaces were commemorative. So Ishmael Ali was my inflection point in 2010. We grew up in Detroit as boys together. My dad was our softball coach. And at 21, he was murdered. And he was my clarity that service can't wait. I got to get involved today. And so thousands of young men have been mentored as a result of his life. Lived short, but still impactful. And so I remember in 2022, when we dedicated that space, I said, we want to put this in his name so that his generations remember, his children, his nieces, his nephews, his brothers, his sisters. And when we hosted it, they had no idea his inflection point was that huge. It was just their reaction. If we didn't house one person, 13 residents later, I'm convinced that was the right thing to do. It gives us a grounding every time we come in that space. I'm going there when I leave here to shoot another interview. And every time we do anything there, he's remembered. We have a beautiful portrait of him that lives in the front room that you don't go into the space without asking, who is that? Our women's home, the Estella Boyd Home for Women. Many people know of Mother Boyd's history. She was the woman that led Marvin Winans to Christ. All the Winans went to their church. Bishop Jesse T. Stacks was the pastor. Mother Boyd was like the church mother. But prolific impact around the world in her history of ministry. She was one of the first women really given license to go forth in ministry here in Detroit. And, she was powerful in church, but she discipled women. She kept women, would take them off the streets into her home and nurse them and care for them and rehabilitate them. And those women's impact is major. I mean, in the millions of people reached through their influence. And so we want to speak her name. Darren Darby, an artist friend of ours, we were on the phone yesterday looking at how we will be weaving a portrait of her together to install in the home, to do a formal dedication later this year. But names are important. History is important. And if you don't tell the stories, how can they know? How can they remember? And so we have institutionalized these individuals and building our own institutions. We can go to museums. We can look at sculptures. What have we remembered? What have we deemed worthy of telling?
That's right. And I when I hear you say their names, again, we're going back into our roots, our heritage. And before the transatlantic slave trade, when we were on the continent,
yes,
ceremonially, we would call forth their names so that they would always be remembered. They live in our body. Mother Boyd is in our body. Your friend Ishmael, Ashe, lives in the body.
Yes.
And you bring me to another point that I don't think we talk enough of, Black men in grief. And so when we talk about mental health, I love that we have folks like you and Jason Wilson who are doing the work around supporting young men, young Black men to process their emotions. But when you think about the legacy work that you're doing with the Black Legacy Achievement Coalition, what are some of the ways that you're helping? And I see it clearly with the way you have done this beautiful dedication to your friend Ishmael. But what are some of the other ways in which you're supporting Black men and processing grief?
This right here. Holding space, sharing space, talking with intention. I was in the car the other day. Monday night, we do a men's and women's Life Talks mentoring session. And one of the young men rode home with me and we were going to get out the car. And he said, I just need to talk for a second. So we sat there and processed. And as I got to hear him that night earlier, a couple of our young men shared their testimonies and their stories of what's been happening over their time in the program as Ground Up Leadership Fellows. And I was floored to hear out of their spirit their own story. And sometimes you can be doing work and you don't know how it's taking. And it's almost like a prescription. you can take it for a while and then, you start to see results and it's like, okay, this took, and I'm starting to see the remedy doing what it does, where when you love right, it's good. That's that good old elderberry syrup. You put it in there, it's going to do its thing. Okay.
Okay, Dexter. Listen.
And I'm so proud. I'm so proud of our young men. Almost every greeting, I'll oftentimes have them on speakerphone when I'm doing things, and I very rarely travel alone. So somebody in the car. And I remember a couple of weeks ago, I got 3 or 4 calls from our mentees, and every brother ended the call with, "I love you." And they was just taken by that. Like, you got grown masculine men out here talking about, "I love you." Like, how did you normalize that? And we never really said it we say it comfortably. But it was more, I think, the environment that dictates the behavior.
So you said something really instrumental here about normalizing, or the lack thereof, the normalization of telling just brother to brother, "I love you."
Yes.
And there not be any guilt or shame around that.
Yes.
How do we normalize affection, especially within our community? Because we normalize outbursts of anger.
Yeah.
That's normal.
Yeah.
Right? Fits of rage, that's normal. But why can't we just, before you get out of the car, before you get off the phone, that "I love you"?
Yes.
That "I see you."
I see you.
If you need me. Right? Because everything that you're naming is life-saving. And they're not big tasks. No. These are not big, but they are life-affirming.
Yes.
And life-saving.
Yes. I don't think there's any other way other than practice. Some things you can talk about, but until you do them, they don't begin to cultivate change. And I'm not talking about the brothers that you would expect. We have some brothers that they put together and they've read the books and they've done the work to say "I love you" healthily. Mm-hmm. I'm talking about these brothers might have got some bodies to them. They may have done some things that they can't tell us about. And
they got bones buried somewhere.
We are setting a tone at a level that everyone is worthy of love. Everyone has capacity, no matter how buried it may be, and no matter how hidden the floor of that heart may be, that when we find it, it still has a recipe in it. And love is paramount. That can't be without. I had a call from one of my best friends last night. We actually grew up with Ishmael together. And he just needed to talk. And I needed to listen because I need to know where my brother is and how he's doing. And we left the call not fully resolved, but better. And I think you said it earlier, being seen as men, I think that is the biggest gift that we can give one another is "I see you. I'm not here to fix you or your situation, but I am here with you through it." Mm-hmm. And giving that gift of presence, that's the love.
That's right. That's right.
That's the love.
Can I get a witness? Not just, but really, that is so monumental and that creates such a shift. Dexter, this conversation, I think, is healing on a multitude of levels. I think it centers so much back to perhaps some of the traditions and ways that we've gotten away from as a society. Communal. Ancestral.
Yeah.
Knowing who your people are.
Yeah.
Checking in on friends, family, and neighbors. Even though we're in the North, what you are reminding me is so much of our Southern identity and heritage.
Oh, yes.
And how it traverses, even harking us back to the continent, even though many of us may not have gone back home. Home still lives and resides within us. If you could share just one pearl of wisdom or a takeaway for our listeners to not only support the work, of course, Black Legacy Advancement Coalition, but one word for health. Give us a health note for those who are listening.
Get to the table. One of the things that we do almost in every setting, if I show up to a meeting and I don't have something to eat, I'm getting some looks like, where is the food? And we try to be as intentional as possible. We have some great food partners, Metro Food Rescue, Forgotten Harvest, Peter Way, healthier options. And if you've been eating fried chicken and chitlins all your life, you may not shift to vegan immediately. Clean eating, that's a journey. So we are very clean eaters, some cleaner than others. But oftentimes when we're hosting space, food is a neutralizer. And there may be some things that are hard to talk about that around a dinner table, you can say it. And so hosting, preparing a meal together, peeling potatoes, chopping onions, preparing the peppers. I'm getting ready for garden season. So we're putting down seeds and doing that piece. And oftentimes if I have to have a hard conversation with a young person, that talking at them is never the solution, but even sometimes discourse won't get it. Let's get in this dirt together. And there's so many lessons that I have shared over dirt that I can't even count them. But we are dust to dust, ash to ash, dust to dust, dirt to dirt. This is home. And so we get in there and we can talk about the parables of the seeds and what's going in, and are we cultivating what we need to grow. And
I hear you, Octavia. I can hear you coming through, Octavia, but come on, our literary ancestors. I hear you coming through. Parable of the sower.
I'm telling you, and it's all connected. The closer we are to the earth, the more grounded we are, the better we do. And there's less that you need to say. Sometimes we're trying to answer everything and everybody, when at the end of the day, we just need to settle down. And for me, what I'm witnessing work is healthy environments, getting that table together. The dining room table to me is sacred. Nothing lives in there other than meals and people and laughter. But that table stays set until we're ready to visit it again. And nurturing that space for our young people, that teaches them how to show up and how to be, that you are worthy of a fine plate, china, with all of the goods. And that's me telling you, I may not use the words, but I'm telling you that there's love for you here at this table. We got to get back to the table.
And on that note, getting back to the table, that there has been a place prepared for you. I want to thank you, Dexter, for your leadership.
Oh my goodness.
Your heart, your commitment to building a stronger and more equitable system, because love is infrastructure. To all of our listeners, you can follow the Black Legacy Advancement Coalition at Black BLC Coalition, and Dexter at Dexter Sullivan. This, Good Humans, has been Health Disparities Podcast with Movement is Life. I have been your host and guide through this auditory journey with my good brother, Dexter Sullivan. I am Ber Henda Williams. Until next time.